today, I will give the discussion about Cri Du Chat Syndrome, also known as cat's cry syndrome. Introduction. What is Cri Du Chat or cat's cry syndrome? It is also known as 5p- syndrome. It is a chromosomal condition that results when a piece of chromosome 5 is missing. Infants with this condition often have a high-pitched cry that sounds like that of a cat. The disorder is characterized by intellectual disability and delayed development, small head size, microcephaly, low birth weight, and weak muscle tone, also called as hypotonia in infancy. Affected individuals also have distinctive facial features, including widely set eyes, also called as hypertelorism, low set ears, a small jaw, and a rounded face. Some children with Cri Du Chat syndrome are born with a heart defect. So, in this figure, you can see that their mouth is protruding because of small jaw. Symptoms. Cri Du Chat syndrome is frequently identified at birth. So, newborn baby may exhibit the following symptoms: difficulties with suckling and swallowing, gastric reflux, constipation, high rate of infections such as ear and upper respiratory tract infections, poor muscle tone, eye problems such as strabismus, also other problems, hearing loss, deformities of the skeleton, scoliosis, hernias, heart and kidney problems, skin tags in front of ear, delayed motor development, webbing of or fusing of fingers, and delayed growth of the child. Diagnosis. So, in newborns, the diagnosis of Cri Du Chat syndrome is confirmed by a thorough clinical evaluation, identification of characteristic findings, example cat-like Reich, and chromosomal studies like karyotyping that reveal a deletion on the short arm of chromosome 5. A specific test known as fluorescence in situ hybridization, or FISH, may be used to confirm a diagnosis of Cri Du Chat syndrome. Chromosomal studies may also be performed to determine whether a balanced translocation is present in one parent. Additional diagnostic tests may be used to determine the extent of the disorder, such as X-rays to reveal skeletal abnormalities, such as scoliosis. Scientific techniques in determining chromosomal abnormalities are becoming more and more refined. This means diagnostic techniques have improved, and in certain instances, prenatal diagnosis of Cri Du Chat syndrome is possible. Clinical symptoms of Cri Du Chat syndrome usually include a high-pitched cat-like cry, mental retardation, delayed development, distinctive facial features, small head size, widely spaced eyes, low birth weight, and weak muscle tone in infancy. So, most individuals who have Cri Du Chat syndrome have difficulty with language. Half of children learn sufficient verbal skills to communicate. Some individuals learn to use short sentences, while others express themselves with a few basic words, gestures, or sign language. Other characteristics may include feeding difficulties, delays in walking, hyperactivity, scoliosis, and significant retardation. A small number of children are born with serious organ defects and other life-threatening medical conditions, although most individuals with Cri Du Chat syndrome have a normal life expectancy. Both children and adults with this syndrome are usually happy and friendly and enjoy social interaction. Screening test. So, you have 3. A specific test known as FISH may be used to confirm a diagnosis of Cri Du Chat syndrome. So, next, chromosomal studies may also be performed to determine whether a balanced translocation is present in one parent. So, PCR-based techniques, these are the methods that rely on the polymerase chain reaction to amplify stretches of DNA by creating many identical or near identical copies. For example, PCR amplification can be used to isolate the sequence at a specific location in the genome. Molecular testing. So we have for Sanger sequencing. It is also known as the chain termination method. It is a method of DNA sequencing based on the selective incorporation of chain terminating deoxynucleotides by DNA polymerase during in vitro DNA replication. The next one is karyotyping. It is the process of pairing and ordering all the chromosomes of an organism, thus providing a genome-wide snapshot of an individual's chromosomes. Karyotypes are prepared using standardized staining procedures that reveal characteristic structural features for each chromosome. Next one is whole exome sequencing. So, whole exome sequencing, it is a genomic technique for sequencing all of the protein coding regions of genes in a genome, also known as the exome. It consists of two steps. The first step is to select only the subset of DNA that encodes proteins. And the second step is to sequence the exonic DNA using any high-throughput DNA sequencing technology. And the last one is MLPA, also known as multiplex ligation dependent probe amplification. It is a recently introduced method based on PCR principle. It is useful for the detection of different genetic abnormalities. Treatment. Cri Du Chat Syndrome has no cure. Treatment aims to stimulate the child and assist them in reaching their full potential and may include the following. So, the treatment may require the coordinated efforts of a team of specialists such as pediatricians, orthopedists, surgeons, cardiologists, speech pathologists, neurologists, dentists, physical and occupational therapists, and other healthcare professionals may need to systematically and comprehensively plan an affected child's treatment. As some children with Cri Du Chat can have sensory neural deafness, auditory testing should be performed. So, treatment, physiotherapy to improve their poor muscle tone. So, next one is speech therapy to help the muscle make the right sounds and use the voice properly, since sometimes they are mispronouncing the words that they want to say. Next is communication alternatives such as sign language, since their speech is usually delayed, often severely. And the last is occupational therapy to teach them to cope strategies and new skills that they can use in their daily lives. So, thank you.